hamstring pain related to your sciatica coming up next. Hey, Cat Matlock here at FreeBody, and really happy to share with you some information so that you can understand today more about hamstring aching and hamstring pain when you're having sciatica symptoms. So whenever someone comes to me and they say, I'm having this pain, as a trigger point specialist, my first thought is, what are the trigger points that could cause that pain? Because trigger points are tricky, right? They're little focal points of tension in your muscles that cause pain somewhere else. Sometimes it's pretty far away. So in this scenario, the trigger points that cause aching in the hamstrings, those trigger points could live in piriformis, which you've all heard of, but they can also live in gluteus minimus. And it could be just a little tiny point right on the outside of your pelvis, on the side of your hip, that you never knew you had, causing terrible hamstring aching. So I want to talk to you about, how do you know the difference between the two? Is it piriformis or is it glute min? With sciatica symptoms, there's a whole big picture, right? So I also want to preface it with the piriformis might be getting pulled by other muscles. The gluteus minimus might be getting pulled by other muscles and causing the dysfunction. The root of the pain might be living in these muscles, but there might be a bigger picture. So keeping that in mind is really helpful. Piriformis often gets blamed for a lot of sciatica problems. And what I find is that sometimes it's part of it and sometimes it really isn't. Because the sciatic nerve comes out and exits from the sacrum area right next to where piriformis attaches, piriformis often gets blamed, and it can be really tender around there, but that also might be just a function of things in the pelvis being really off. The pain referral pattern of trigger points in the piriformis muscle is really just aching down the hamstring and deep aching in the butt near the piriformis attachments by the sacrum and by the hip joint, and then some aching down the hamstrings, and that's it. So gluteus minimus, though that can refer into the hamstrings and even into the calf, it can also refer a deep ache in your buttocks. Glute min can also refer down the iliotibial band and even into your shin. So while those trigger points can cause hamstring pain, it's also going to cause a whole bunch of other stuff. Whereas piriformis is never going to refer down the outside of the leg ever. It's almost never going to refer also into your calves. So it can be helpful to check out what are all the symptoms, notice what are all the places that you're feeling sensation, pain, discomfort, and use that as a way to discern where your trigger points are. So piriformis, it's going to be just down, like in the butt, near the sacrum, near the hip joint, down the hamstrings. Glute min, it's going to be deep ache in the butt for sure, and then also down the hamstrings, but also often down the calf. Also could include that outer thigh and even the shin. Deep ache in the butt. Blah. Both of them can cause deep ache in the butt. It just shows up in different places in your butt, right? But with this hamstring tension, it's really helpful to just treat both muscles. You can just treat both muscles to see kind of where it's coming from. So I'm going to show you a video on how to treat piriformis, and then I'm going to show you a video on how to treat, just with a little ball, just to treat the gluteus minimus, and you're going to get TFL because that's right next to glute min. It often has a big play in glute min tension. So you're going to learn how to release those trigger points coming up next. To release your piriformis, you're going to need a clear space at a wall, and you're going to need these two balls. You're going to need the soft FreeBody ball. You're really especially going to need this soft ball because if your piriformis is really jacked up with tension, and especially if it's doing any pressing on the sciatic nerve, a smaller, firmer ball is going to be too much and might actually aggravate that nerve sensitivity and aggravate your symptoms. So you definitely want the softest ball you have. Hopefully you have one of these soft FreeBody balls, because this is really the best tool. Then once some of that sensitivity has gone down, then you can use the small myofoam ball is my ball of choice for this practice. So FreeBody softball, small myofoam ball. Let's go to the wall and release that piriformis and the deep 6 lateral hip rotators. So I want to show you where the piriformis lives in the body and how to find it. So here is the sacrum bone in the center of the 2 sides of the pelvis. And then here on the outside of the hip is a hard bony nub. That's the greater trochanter of the femur. So the piriformis goes from about the mid-sacral area to that greater trochanter of the femur. And so yes, it does externally rotate. Most of the time it turns that femur out like that. So to get the 2 points, there's one that lives right at the edge of the sacrum, and then one that lives right behind that greater trochanter of the femur. Then we're going to go down and get into those other lateral hip rotators that follow deep down below that line. So we're just going to kind of clear this whole back of the hip joint. So we're going to start with that soft FreeBody ball. You're going to bring your back and your butt to the wall. And then notice that what's resting against the wall is that sacrum in the middle of the 2 sides of the pelvis. We're going to start by taking this ball and putting it just to the right of the sacrum on the right side of the body. And we're going to stay kind of facing straight out toward the center of the room and go up and down along that sacrum. It should feel gentle with this soft ball. You want to hydrate this tissue. You want to not freak it out by going too firm, too deep, too fast. You will have trouble clearing the tension if you're shocking your nervous system with too firm of a ball. So we're just going to go up and down along that sacrum. And then you're looking about halfway down or just an inch or 2 from the top. Often there's a little tender spot in there. Now I'm going to rock a little side to side. I'm going to see if I can rock all the way out to that greater trochanter of the femur. When I get out to that point, I feel my body is holding that trigger point. I'm not feeling my body holding that inner trigger point, but yours might be holding trigger points on both sides. I'm going side to side. And then if you're using the firmer ball, and put that soft ball down. If you're using the firmer ball, or if you've warmed it up now with that soft ball, now as I get into along that edge of the sacrum, right where that piriformis lives, again, just an inch or so down from the top of the sacrum or halfway down. And you can go up and down along the sacrum. See if you can find that tender spot in the middle. That tender spot in the middle is along the sacrum is your piriformis. So I'm going to sink into that spot. If it's too much pressure, just step your feet in closer to the wall. If you want more pressure, step your feet away from the wall, and that's going to sink your body weight more deeply. That just got a little too much. So I'm going to step in a little closer. That got real exciting there for me, so I'm going to step in a little closer. And just maybe a little wiggle side to side, gentle pressure there. And breathing in your belly always. Couple breaths. And you can hold on here, 3, 4, 5 breaths. You're not going to want to hold too much longer than that. You can take micro movements, micro bends in the knees, maybe going up and down, making sure you're getting right on that most exquisite spot. Notice I turned my body just slightly to the right, so I could kind of trap that point against the sacrum. So we started straight on, going up and down, getting that warmed up, and then turning a little bit to the right, now really carving along that edge of the sacrum. Now that's plenty of time there. Now I'm going to just slide that ball out so that I'm right behind the hip joint, right behind where the femur dives into the hip. So that's pretty far out there. And when I go up and down along that area, at the top of that hip joint, so here's the sacrum, now I'm out here, and I was right here next to it. Now I've migrated over the outside attachment or the lateral attachment of the piriformis, and now I am going up and down there. So you're going to do this on the affected side. Often piriformis is not a bilateral issue. It's usually one side or the other. So we're just going to treat this one side. That feels so good. And I'm going to kind of wiggle on it. I found a real tender spot by just gently going up and down here. You might find more tender spots up high. That's gluteus medius. That's another treatment altogether. And really, wherever you find a tender spot, I want you to breathe and sink and relax your body. Relax your jaw. Relax the rest of your body. That's going to help your body receive that ball. It's actually going to go in a little more deeply, and it's going to help that piriformis to relax for you. So now I'm just going to cruise along the line of the piriformis, rocking the body side to side, cruising along. And then to finish our treatment, we just want to give the deep 6 lateral hip rotators a little bit of attention. So you'll see me bend forward a little bit. That's going to kind of open up that space for the ball to go behind the femur there and up to the piriformis. Oh, it's so exciting. You do need a smaller ball, like a small myofoam ball, to get in there because they're deep and it's real specific and it's a small space. So you just want to be kind of sweet and gentle. Stay close with your feet to the wall. And then one thing you could do is just kind of wave your knee side to side. This external rotation, internal rotation, external rotation, internal rotation. That's going to kind of wave it under the ball. Ooh, so exciting. Bending over a little bit, kind of opening that door right there. Whew. All right. And then when we're done, we're going to do that really famous piriformis stretch at the wall. So bringing your hands to the wall, you're going to step back from the wall a little bit, bend both knees. Okay, and then I'm just going to move my hand so that you can see. And I'm going to bend. I was working that right side, so I'm going to stretch the right side by crossing the right ankle over the left knee. That really famous figure 4 piriformis and lateral hip rotator stretch, right? But here's how we're going to do it differently. You're going to push that right ankle into the top of the left thigh. I don't want it to be relaxed and yanking on it, right? You're really engaging. That actually sends a signal to the nervous system. The tissue's not going to tear, and you'll actually go deeper into this stretch. So at the wall, hands to the wall, right ankle over the left thigh, and then the more you bend that standing leg and the more you stick your butt out behind you, the kind of deeper into those hip rotators you get. And you could walk down the wall, down the wall, down the wall. Feels so good. Pressing that right ankle. Your stretch might just look like this. Right? Over time, you do that release at the wall with the balls, and then you come into this stretch. It gets better and better every time. So just taking another breath here. Right? And then you're going to release and come up to stand. This quick fix is for releasing TFL and glute min on the floor. And start with the soft ball. Always start with that soft blue ball, the logo ball, so that you are not driving in to the most tender places in your body too quickly. So TFL, glute min, they're all on the side of the pelvis and to the front of the pelvis. So we're going to take that soft ball, come down on the floor so you're sitting a little bit off to the side, and slide it in. Notice I didn't lift up and put it here. I don't want it under the side of my thigh. I want it on the side of the pelvis, right? And then from there, you can lay down on the ball. Now, we started with the soft ball so that we could just explore and sink in. If I take this top knee and I drop it down onto the bottom knee, now I've got that much more pressure. If I need less pressure, I'm going to take it off with that top knee, taking that off. So starting in this position with the knee lifted so that there's the least amount of pressure. Then you can kind of play and explore. When you're ready, put that top knee down. Now there's more pressure. You can kind of sink your body into the ball. For many of you in the beginning, that's going to be plenty. That's going to be so much pressure. You'll be plenty. So where you are, straight up and down with the hips stacked, you're in gluteus minimus. When you want to go to TFL, we're going to take that top leg forward. I'm going to show you that in a minute. But just kind of letting the ball sink in, just getting used to this idea. If after a few moments and you're letting the ball sink in, it's not enough pressure, then you can switch to the larger myofoam ball, or I'm going to switch to the smaller ball. So I'm going to put the smaller ball right there. Now, make sure you start with that knee lifted, because boy, is that going to be a lot more excitement, a lot more sensation than that soft ball. So you might just stay with that knee lifted. When you're ready, you can stack them, right? So now we're in the side of the hip, right in gluteus minimus. And you can kind of sink, if you lift these ribs up and away, see how that lifts my pelvis off the ball? That's a way that you can easily shift pressure, like, oh, take those top ribs up and away. When you want more pressure, now you can take those bottom ribs down toward the floor, and that's going to help you sink into the ball. Right there, gluteus minimus. So now ways to work with that, drawing your body up, like putting that elbow down on the floor, and then like using that elbow to pull your body up. That's going to drive that ball right into the top of the femur, trapping that littlest segment of gluteus minimus right into the top of the femur. So just take a couple breaths here. Right. And then we want to take some pressure out, lift those top ribs, maybe lift that knee, slide the body down so the ball just goes a little further up along the side of the pelvis, keeping the knees basically, the hips, basically stacked. Now I'm just higher up along that side of the hip, and I sink down into it. And then you could take that top hip forward a little and back a little, and you can play with just like that movement right there, forward a little and back a little, finding very exquisite tender spot, sink in gluteus minimus. Now we're going to explore a little bit to the back part of gluteus minimus. So lift the ribs, lift that top knee, start rolling a little bit toward your back, and then scoot your pelvis forward. I'm going to show that again. We start stacked, lift that top knee up, lean back, scoot the pelvis forward. Now you're at the back of gluteus minimus. Oh, and it's exciting. There's a lot of tension going on in there. Yes, indeed there is. So taking a couple of breaths there. And again, you want to check jaw. Relax your eyes. Notice, do you want to wiggle a little bit? That's totally fine. Breathing, always breathing in the belly. So good, right? Okay, now we're going to shift. We're going to come back to the center. And then we're going to go into TFL. So for TFL, we take that front leg and we slide it back. And then we take the top knee and the foot and cross it over. And now we're going to begin, because TFL is toward the front of the pelvis, so we have to start dropping that top hip forward. And there it is. Notice I didn't go all the way forward. If I go all the way forward, I'm not going to get it. I have to go about halfway. So from hips being stacked to top hip dropping, if you keep this bottom knee bent a little bit, it keeps that tissue a little softer and allows the ball to sink in. As soon as you straighten that leg, you might actually tense that tissue so much that it pops the ball out. So bottom knee stays bent.
top leg and knee come forward. Drop that knee toward the floor. I can just touch the floor, and then I'm really in a very tender spot at the front of my pelvis, tensor fascia lata. Great, and then we're gonna move off by rolling that top hip back. And then we're gonna do the other side. So now for the second side, try a different ball. Play with the different balls until you find, and sometimes what you'll find is that if you've just ridden your bike or gone on a long hike or ridden your horse, done your work, your joy, your fun stuff that causes an aggravation of your symptoms, what you'll find is that sometimes you'll just need to go right back to that softer ball. Like, oh, okay, everything's excited today. So give yourself permission that once you use the small, hard ball, that sometimes you don't use that ball, right? Because it's not like you always just continue. It's that the tension's going to come and go. The tension's going to come and go. All right, so this side, I'm going to lay down on my side. I'm going to slide that large myofoam ball underneath the side of the hip. And for me, that lifts my pelvis all the way up off of the floor even. So good. And this gets a little bit of a bigger area. This actually makes for a faster, quick fix if you're just using this big ball. Going right through the top of the iliotibial band to get to that gluteus minimus underneath. So we're going to put that elbow down, slide the body up until we're trapping gluteus minimus against the greater trochanter. So exciting. Take a couple of breaths here. And then we're going to slide up. There's not as much space to move with the bigger ball, you'll notice, right? So if you want to go ahead and slide the smaller ball in, or if this ball is too firm and you need the softer ball, notice I'm not putting this knee down because I don't need quite that much pressure, right? How could I take pressure out? I could lift those top ribs. I could take that top knee off, okay? And then we're going to move to the back of gluteus minimus. Now we've covered that front side, that very directly under the iliotibial band. So to do that, we move back, we roll back toward our back, and then scoot the hip forward a little bit, right? Slide that hip forward. Now the ball's gone to behind the iliotibial band area on the side of the hip to get in that back part of gluteus minimus. Oh, it's so good. And you could do a little up and down. So good. You're going to find a lot of tenderness here. It's okay. That's why we're here, right? We're going to get rid of some of that tenderness and get you out of pain. One more breath here. Now to go into TFL. You scoot back, stack the hips, slide the bottom leg back a little, take the top leg over, and then roll toward the front. Now for me, this big ball is a little bit too big for me to get into my TFL. So I'm going to move off, get that smaller myofoam, slide it in there, drop my ribs so I get a little bit deeper pressure. Top knee crosses over, roll toward the front of the body, but not all the way, right? Toward the front of the body. There it is. And a couple breaths here. You're right at the crease of the side of the hip. So good. All right. Now we need to do a little quick stretch. So we're going to do a little bit of what I call the flip-flop, where you stretch your legs out and flip-flop, flip-flop, flip-flop. Side to side. Great. Then we're going to do a TFL stretch. So we're going to come to here. This TFL on the right side is getting stretched because it's a hip flexor, so I'm in big hip extension. And then to get to the other side, we're just going to flip around. Go into that other side, stretching that TFL. And then to stretch the glutes, we're just going to lay right on the back, knees bent, feet on the floor, and do a little windshield wipers side to side. And dropping that down, dropping the knees side to side. Stretching glutes on this side, then stretching glutes on that side. Great, and that's it. So that's our quick fix for TFL and gluteus minimus. Welcome back. I know that you found that at least exciting to learn where those trigger points are and get a ball into those trigger points. Very exciting indeed. Also understanding that sciatica is a big picture puzzle. It's a big picture, and so there's a lot of pieces at play. I love to help people, support them getting out of sciatica pain because I know how horrible it is, and I know how liberating it is to get out of that pain in my own body and with thousands of other people that I've helped. So you can check out the information below. We have some upcoming workshops. I'm always leading some workshops on helping people understand pieces of sciatica and the bigger picture and helping them get out of pain. So check that out. Hey, before you go, click on the link below, ineedsciaticrelief.com, and you'll get a free download of how to get yourself immediate relief from sciatica pain. Get immediate relief from sciatica pain. Click on the link below and grab yours today.